For 6 years, Olivia Bland struggled with more and more pain. She stopped explaining why she needed to stay home from work, skip exercise, or cancel plans with friends. I just felt too embarrassed and tired of telling people how bad I felt, said Olivia, who works as an accountant in Albuquerque and is now 37 years old. Between 2012 and 2018, Olivia saw her own doctors and went to the urgent care or emergency room 8 times because her stomach hurt a lot. She also had a mild fever in the afternoon and felt really tired. I could drink 2 cups of coffee at 9:30 p.m. and fall asleep by 10, she remembered. But even after sleeping for 10 hours, she still felt tired. Her doctor told her to eat better after another doctor couldn't find anything wrong with her. He said he didn't need to see her again. Then, in July 2018, a different doctor looked at Olivia's latest CT scan and saw 2 problems that nobody noticed before. It took another year for Olivia to find the right treatment. I think about my pain every morning when I wake up, Olivia said recently. She's surprised by how much better she feels now. I can't even explain how different it is. Olivia always had stomach problems. When she was 18, the doctor said she had irritable bowel syndrome, which makes you have diarrhea and feel bloated. But the pain in her lower stomach that started in 2012, 2 years after her first child was born, felt different. Sometimes it was a heavy ache, and sometimes it was so sharp she thought she might have appendicitis. Normally, she didn't pay a lot of attention to pain. She had a high threshold and had twice given birth without painkillers. Her internist ordered an abdominal CT scan, which was later found to be normal. Then the pain disappeared. By 2014, a year after her second child was born, it began to recur every month and last anywhere from a few days to a week. When maximum doses of over-the-counter pain relievers didn't help, Bland headed to an urgent care center, or ER, where doctors repeatedly found no explanation. In March 2017, Bland consulted her internist. The doctor was curt. She said that all women have abdominal pain, Bland recalled, and prescribed a drug to treat acid reflux. When Bland protested her pain wasn't reflux, the doctor advised her to eat better before walking out. Next, she consulted the nurse midwife who delivered her first child. She recommended an endometrial ablation, a procedure usually performed to treat excessively heavy periods, which the nurse said had helped someone with severe abdominal pain. Bland scheduled a procedure then canceled it, fearing it might prove ineffective. In November, she returned to the rheumatologist she'd been seeing for possible lupus, an autoimmune disease that causes inflammation and pain. She took her husband Jeff to the appointment to attest to her fatigue. Bland also fervently hoped testing would reveal an underactive thyroid, which can cause lethargy. Both parents and her sister had been treated for thyroid disorders. When the rheumatologist told Bland she had neither lupus nor a sluggish thyroid, she began to cry. He looked at me and said, "You've realized you're crying because your blood work is normal," she recalled. I knew how crazy I looked, but I couldn't handle another negative test. After refusing his offer of antidepressants, the doctor told her he would no longer see her unless there was a change in her medical history. The episodes had begun to occur more frequently, and Bland's family life was suffering. Every birthday, Mother's Day, and Christmas, my husband would ask what I want, and I would break down crying and say, "I just want to sleep. That's it. I want to sleep for 24 hours. During a game of charades, her young son betrayed a character who walked hunched over and took tiny steps. After a volley of wrong guesses, the 7-year-old excitedly blurted out, "You, Mom." Bland remembers fighting back tears. "I just felt so awful. That's how my children saw me." In 2018, a new and supportive internist sent her for a colonoscopy and ordered tests for celiac disease, a common autoimmune disorder caused by eating gluten, and H. pylori, the bacteria that causes ulcers. All were normal. At that point, Bland said she began to question her sanity. Did I need attention from other people? Was I actually lazy? I started to really wonder if I was what everyone else thought I was, a hypochondriac, an awful person who doesn't play with her kids. In July 2018, after the pain moved to her back, Bland wondered if she might have a kidney stone. Her internist ordered a urine analysis that detected blood in her urine. The doctor then ordered a CT scan of her abdomen and pelvis. Although Bland had undergone the same scan in the past, this one would turn out to be life-changing. The scan revealed that Bland appeared to have 2 sometimes interrelated conditions, pelvic congestion syndrome and the less common nutcracker syndrome. Pelvic congestion syndrome often occurs during pregnancy when varicose veins develop around the ovaries. These veins become engorged, resulting in the pooling of blood that can cause significant pain. Pelvic congestion can indicate the presence of nutcracker syndrome, which occurs when the left renal vein that carries blood purified by the left kidney becomes compressed. Obstructing blood flow, sometimes known as nutcracker syndrome, can cause no symptoms, but in other cases, it can lead to a condition called loin pain hematuria syndrome, which includes blood in the urine and severe stomach pain. "I was thrilled. It was the best news ever," Bland said. After 6 years of uncertainty, she finally had an answer that didn't make her feel crazy. Her internist sent her to a gynecologist who was unsure how to help. Then, she saw an interventional radiologist who diagnosed her. He suggested a procedure called embolization to stop the pooling of blood, but he warned it might make her nutcracker symptoms worse. At first, Bland was ready to try anything to stop the pain, but soon she had doubts. Her family disagreed, and the radiologist admitted he wasn't experienced in this type of procedure outside of the brain. After reading an explicit warning on the website of a support group for nutcracker patients, she canceled the procedure. Online, she encountered women who had undergone kidney autotransplant surgery to treat the pain caused by nutcracker or loin pain hematuria. A major operation, autotransplant, involves removing the affected kidney and ureter, the tube that carries urine from the kidney to the bladder, and relocating it to the other side. The operation doesn't carry the risk of organ rejection and is reserved for patients who have exhausted less invasive options, including anesthetic infusions. One name kept recurring: pioneering transplant surgeon Hans Solinger of the University of Wisconsin at Madison. In September 2018, Bland contacted Solinger, who's since retired and is now a professional emeritus. After an interview with UW's transplant coordinator and a review of her records, Bland was told she'd need to undergo a prerequisite test Solinger and his colleagues had developed to determine which patients might benefit from a transplant. The test involves the injection of a local anesthetic into the ureter. Patients who remain pain-free for at least 12 hours are deemed transplant candidates. Loin pain hematuria syndrome, Solinger said in an email, is believed to originate in the ureter, where spasms cause pain likened to continually passing a kidney stone. Bland called 3 surgeons in New Mexico, all of whom refused to perform the test, but she faced an even bigger obstacle. Her insurance didn't cover out-of-state treatment, and her supportive husband was opposed, worried that she was rushing into surgery based on unsubstantiated information on Facebook. A month later, the couple spoke by phone with one of Solinger's protégés, transplant surgeon Robert Redfield III. Redfield, now leading the living donor kidney transplant program at the University of Pennsylvania, had a crucial conversation with Bland and her husband. He urged them not to give up hope and assured them they could help. This talk was a turning point for Bland. Later, during open enrollment, Bland's husband changed their insurance to cover treatment out of state. Redfield often supports spouses of transplant patients, understanding the strain it can put on relationships. He highlighted the significant impact of loin pain hematuria on patients' lives. Over the past 4 years, Redfield's team in Wisconsin has assessed 200 patients and performed autotransplants on 80, with about 80% experiencing significant pain relief. This includes patients, like a teenager, who relied on strong pain medication. After the transplant, Bland's pain went away and she didn't need pain medication anymore, according to Redfield. He questioned whether a transplant could improve their quality of life and if the risks were worth it. He mentioned the lack of research on loin pain hematuria syndrome. Bland went for a pre-surgery test in May 2019, during which her pain disappeared for over 24 hours. The day after, on her 36th birthday, Redfield said she could have the transplant, which she considered the best birthday gift ever. Initially, her insurance denied coverage, but they changed their decision after UW Health appealed. The 2 months leading to Bland's surgery in July 2019 were very tough, as she could hardly function and worried about not being a candidate. Her 7-hour surgery, performed by Redfield, was followed by a hospital stay and recovery period. After about 9 months, Bland fully recovered, and her pain, exhaustion, and fever vanished. She expressed immense gratitude to Redfield and his team for saving her.